Good evening. Shri Gurubhyo Namaha. Instead of going on doing CMEs, I think it's better once if we check how much topic we have covered so far. It initially started with Dr. Ravi Shankar Pervaj's idea and vision, who is the arbitrator, force and mastermind and guiding force behind Dr. Sharma sir's lecture series. We are very thankful to Dr. Pervaje sir for his gesture. Yeah. It's our great blessing, and we are luckiest disciples of Dr. Sharma sir because he agreed, took all the pain to teach us. There are no words to explain. Just thank you may be a very small word. If we follow at least 1 or 2 points which he taught us, that will be a biggest gratitude or Guru Dakshina to Sharma sir. Now, just to recap or refresh, what are the subjects we covered so far? We already finished 6 lectures so far in this series, and now we are into 7th one. Next one. Like in lecture series 1, it is about Ayur practice, like basics about Ayurvedic practice. In his first lecture, Dr. Sharma sir presented a simple model of Ayurvedic practice, which is viable. This is how everything we started. Initially, it is Ravi Shankar Parvaje sir's idea. Then Sharma sir gratefully agreed to teach us. Then finally, we took permission from our seniors, Dr. Narayan Asra, and my friend Sudhakar also agreed to escort Dr. Sharma sir every time. These are things. It is nothing to do with the traffic signals. It is just initially it was an idea. Then something we got some go ahead with Ravi Shankar Pervaje sir and all. Then our seniors agreed to continue. So for everyone, I am very thankful. Then in his first lecture, Sharma sir, actually he presented viable, academic and effective model of practicing. I am adding 2 more things, easy and ethical also. Where he emphasized exclusive use of Ayurvedic medicines, taking technological use for our safety and to confirm the diagnosis. Cost-effective model, so that we can reach up to lower strata of society, using potent, selective, important, commonly used minimum number of preparations. We know it's very difficult to choose or select appropriate drugs out of thousands of formulations. Next. Where Sharma sir here explained beautifully how to use different drugs in various stages of disease, with the example of Pratishaya and Jwara, with simple, effective in terms of cost and result. He also advised about choosing a right patient. As he always says, we all know what to give, when to give, and why to give, but it's important to know what not to give and when not to give. These are, always we remember, these are the golden words in our practice. Here simply we can reject a patient or can refer to a specialist. We like or dislike. That is reference to a competitor, Sharma sir specifically, jokingly said, as we remember that one. He guided us the method of withdrawing existing medications while starting treatment or during the treatment. Systematically, like a tapering or something, stopping some of the medications or continuing with the existing medicines along with our Ayurvedic medicines. Even he explained, higher dose does not mean it's more effective. That is also the thing we learned from Dr. Sharma's lecture series. In lecture series 2, it was about management of pranavasrutas. Here Dr. Sharma sir has covered all diseases and its management, starting from tonsillitis, viral and bacterial, peritonsillar abscesses, candidiasis. I am not mentioning all the things. Here, highlight of this talk was he beautifully explained obstructive and like restrictive lung pathologies, like obstructive like COPD, cystic fibrosis, or interstitial lung diseases, and also like restrictive like obesity and scoliosis like conditions, which is usually we don't find these explanations in contemporary medical textbooks. Another important aspect he told, in the management of pulmonary tuberculosis, along with contemporary anti-tubercular drugs, how effectively we can help patients to enhance the effectiveness of anti-tubercular drugs by using our rasayana preparations and other drugs like Arogyavardhini and Makaradhwaja. As we all know, nowadays it is a MDR-TB, or multi-drug resistance tuberculosis, is increasing. And even many mycobacteria are becoming resistant even for newer drugs like cycloserine or levofloxacin, when first-line drugs like rifampicin, isoniazid, ethambutol, and streptomycin fail to give results. In lecture number series 3, it was about Annavahasrotas. In Annavahasrotas, he explained wide range of disease conditions like stomatitis, aphthous ulcers, candidiasis, leukoplague. I'm not going to list out the things. There are many conditions we discussed during that CME. Highlight of CME was Dr. Sharma sir told how over the years he successfully medically managed the cases of appendicitis and hemorrhoids, which he used to manage those surgically before. Means over the years, based on his clinical experience, he minimized doing surgeries in case of appendicitis and like hemorrhoids. One more important aspect we learned from was use of Mayura Pichavasma as a symptomatic cure for Shardi. That was many our doctor friends already they have adopted in their practices. We had many feedbacks about Mayura Pichavasma and all. In lecture series 4, it was about Udakavasrotas. In Udakavasrotas, we mainly discussed about diabetes mellitus, which was very interesting and thought-provoking, where Dr. Sharma sir has explained myth and reality about much believed thrifty gene theory, which is believed to be related with famine. And because of India's famine, this gene mutated, and that is the one reason for India is having highest number of diabetics. Difference between Indian and European phenotype is different, where Indians are having lean body mass, but unfortunately, following Western food style and sedentary lifestyle, our body mass distribution is changing, and we are marching towards becoming diabetic toppers. Next, he explained how we forgot our basic Indian culture of Atiti Devo Bhava, where guests, others and also animals were fed first, and then we should eat whatever food that has left. That was the basic, lifestyle which we have to follow in our day-to-day life. Then controlling or diabetes is not a much problem. Also, in case of diabetic diet, he specifically explained it's not important what we eat, but it's more important how much we eat and what time we are eating, and many more things. I'm not going to list out the whole thing. Most of the diabetics whose HbA1c is within 7 can be managed only with proper food habits, exercise, and lifestyle changes. Also, Sharma sir explained myth and realities about fasting. That was about lecture number 4. Now about lecture number 5, Rasavasrotas. Here Dr. Sharma sir mainly explained hypertension and cardiovascular diseases. It was much complicated thing, many more things we discussed those times. In case of hypertension, he explained frequently changing guidelines and normal values in the measurement of blood pressure. Normal, elevated, high normal, high blood pressure, stage 1, stage 2, and a hypertensive crisis. This is the present day classification available as such all over the world. I think many countries following this type of classification. Changing normal blood levels and international antihypertensive drug market and its business of billions. That also Sharma sir highlighted. Then hypertension, dyslipidemia, relationship in between two, and some of the myths about high cholesterol levels and diabetes, hypertension, all those things we discussed in the CMEs. But to consider patient as hypertensive is based on totally clinical experience, and treatment is always empirical, because we know that there are many more like normal values. Before we used to say, oh, no, just 128 is normal. Then someone was saying 130, 90 is also can be considered as normal, or it is a high systolic or low, normal. Diastole can be considered normal, or controversies. Many more things we discussed those days. Dr. Sharma sir, based on his clinical experience, has explained like symptomatic hypertension as avarana varieties, major complications of hypertension in hridroga or in jara, like signal changes or the sequelae of hypertension he explained. Interestingly, he explained sarpagandha, which is used by most of our doctors, is not at all a drug of choice in the management of hypertension. Those things also we discuss. This is all about brief recap, whatever we discussed so far.